Welcome to Health Talk.
Today we are talking to Dr. Sushant Swamy. He's a dermatologist from Bangalore. He has his clinic, Tulasi Clinic in Kengeri Satellite Town. It's our privilege to talk to Doctor today. So let's welcome Dr. Sushant Swamy. Welcome, Doctor.
Thank you very much.
Doctor, we had discussed and you suggested that we take the questions from users because let's deal with the current problems. So in that context, we went out, like we went through Facebook and our social channels, and we got a very good response, Doctor. And there are few questions. So shall we go over the questions?
Yes, let's do that.
Okay. Thank you, Doctor. Here is the first question. It's from a 48 years old lady, Priscilla. She says that she started getting pigmentation on her forehead and on cheeks. She has shared a picture also, Doctor. So she's asking what she can do to get it resolved.
Well, the image is not that clear, but then forehead and cheek pigmentation, there are different types when you look at it. If it is diffuse, if it is uniform in pigmentation, the forehead and the cheeks, then I would consider the diagnosis of a photopigmentation. Photopigmentation is a darkening of the skin that happens in response to exposure to ultraviolet rays of the sun. Of course, for that, the first measure would be to start using a sunscreen, and then of course to apply depigmenting creams. And then there is a diffuse uniform pigmentation which is associated with thickening of the skin on the forehead and cheeks as well. In that case, I would consider the diagnosis of acanthosis nigricans. So this is something that happens from within the body. It happens due to a condition known as insulin resistance. Insulin resistance is characterized by normal levels of insulin and normal levels of glucose within the body, but the amount of insulin that is required to sustain the normal level of glucose is slightly higher. And this insulin causes a thickening of the skin of the forehead and the cheeks. So the approach for that would be to get a few investigations done. I usually do a blood workup to get a homeostatic model assessment for insulin resistance done, and then I put them on tablets, and of course a few other creams. So this is about diffuse pigmentation of the forehead and cheeks. If there is pigmentation in the form of spots on the forehead and cheeks, again there are two types. If they have appeared after maybe a pimple, then it just becomes post-inflammatory hyperpigmentation. Well, one can just approach it conservatively by not doing anything at all. That it usually comes down on its own in about 2 to 3 months. If it doesn't come down, again we have creams, peels, lasers. That would obviously be the last resort. And then we have freckles, lentigines and ephyllites. So these are brown color spots that develop on the skin of certain individuals, usually light-skinned individuals. So it happens in individuals who are genetically predisposed for developing these. So even a little bit of sun exposure causes them to develop these brown spots. So they are one of the most challenging types of pigmentation to deal with. So the type of treatment usually involves something that destroys the uppermost layer of the skin. So maybe it is radiofrequency ablation or ablation with a laser, or even with trichloroacetic acid may be done. So that is about the pigmentation query that Ms. Priscilla has.
Okay. Thank you, Doctor. I think a similar query was there. I think you mentioned that brown pigmentation, right? In Kannada, I think they call it as bangu.
Bangu.
Yeah. So
Okay.
there is the one question for that.
We'll address that. That's a slightly, it has a slightly different answer.
Oh, okay,
Yeah.
Doctor. Okay. Thank you, Doctor. Shall we move to the next question?
Yes.
Yeah, this question is asked by two ladies.
Hmm.
They are saying that nowadays we are seeing gray hair in younger children. Earlier it used to be little late, but now we can see very much gray hair in younger children. So they are asking what should a pregnant woman should do, or what they can do to avoid it or postpone it. Any
Okay.
suggestions, doctor?
Fine. So, what is being talked about is something known as premature canities or premature graying of hair. So, the definition of premature graying of hair is the appearance of gray hair before the age of 20. The understanding of what actually causes graying of hair is not very clear. But then, of course, to answer that question, what can one do to avoid? There are a few things that can be done. To begin with, there is little difference between the pigmentation of the skin, the color of the skin, and the color of the hair. So there is a pigment producing cell known as a melanocyte. So this melanocyte produces melanin, the pigment, which is supplied to the skin cells, similarly also to the hair cells. So in the skin, one melanocyte or the pigment producing cell supplies the pigment to 36 skin cells or keratinocytes. Okay, but in the hair, the demand is higher. One melanocyte has to supply 5 keratinocytes in the hair, which is present around the hair bulb. So, one might notice that as one ages, if you took a photograph of an adult who's about 25 years of age, the same adult at about 65 or 75 years of age, they'll be lighter skin because slowly the melanocytes start failing. But this failure of melanocytes is more apparent in the hair because the demand for color is more in the hair shaft. So anything that affects the health of the melanocytes can cause premature graying of hair. So what could that be? Copper deficiency, one of the most common causes of this would be copper deficiency. So copper-rich food would be nuts. And then again, there's something known as calcium pantothenate, which we supplement the patients with. And then again, the hormone melatonin helps in keeping the melanocytes stimulated and active. So melatonin is produced when we sleep. And in the current day scenario, it's a good thing. We have evolved as a species to be, up 24/7. But then the side effect of that is there's a decrease in the amount of melatonin. So when there's a decrease in the amount of melatonin, we can develop gray hair. So if you want to supplement that, we give something known as melatonin. So these are things that can be addressed. Okay, proper sleep, good nutrition. But then there are a lot of times then, when these are not the causes. For example, there are a few autoimmune conditions like pernicious anemia where the absorption of certain vitamins itself is affected. So we'll have to address that. And then in children with thyroid abnormalities, again, gray hair is seen. And very rarely an autosomal dominant type of graying of hair, where if the father has graying of hair, the kid will also have. So these are all different types of graying of hair. So, we can always assess and see what is required. But diet-wise, copper-rich food and a stress-free life for a child sleeping well, that should help.
Yeah. Thank you, doctor. We'll go to the next question, which is asked by Chelsea. What happened is she has got a purple spot on her leg.
Okay.
Actually, her son, I think, pinched.
Okay.
Now she's wondering whether it's because of pinching or whether it's a bruise, but I think it pains a lot.
Can I take a look at the image?
Yeah, here is the image, doctor. It's not clear.
Okay, looks weirder than a bruise. Okay, fine. So the image, okay, Chelsea, okay. Fine. So this does look like a bruise. A bruise usually resolves on, so bruise is basically, the rupture of cutaneous blood vessels because of whatever pressure has been applied. So blood comes out and it just stays there, gives that look. But if it usually resolves on its own in about 2 weeks, some pigmentation is left behind, which will also resolve on its own. But if this this reddish change in the color, skin color persists for more than 3 weeks, I would suggest that Ms. Chelsea go for a biopsy to look for other causes. Chelsea, what's her?
Chelsea, yeah.
Where is she asking the question? Is she Caucasian?
No, we don't know.
We don't know, okay.
Yeah.
Because it's a reddish spot. So reddish spots in white people can also be malignant. It can be a melanoma. melanoma doesn't have to look black.
Mhm.
It can look reddish as well without the pigmentation or even basal cell carcinoma. Better to just get a punch biopsy done and see what it is.
Okay. So she can wait for 2-3 weeks. If it's more than that, I think she has to get
Yes,
a
if it's
biopsy
persisting
done.
beyond that, yeah, just get a biopsy done and get things rolled out.
Okay. Thank you, doctor. Yeah, our next question is from a 21-year-old boy. Actually, he has got eczema. He calls atopic eczema. Actually, it started at the age of 4. First, it came to his sister, but for his sister, it went away. But for him, it is continuing. So he has done many medicines, and yes, it's still, even though the intensity is less, it's still there. So he's asking if there is a like long-term cure for it, or what he can do about it. He has shared a picture also, doctor.
Atopic eczema.
Yeah.
Fine. So, okay. So the word atopy. So this atopy refers to, of course, atopic eczema. There's allergic rhinitis. There is bronchitis. All of these are genetic. So a lot of the responsibility for this problem can be attributed to the genes itself. So with respect to atopic eczema, what's happening at the genetic level? So we have, the skin has 2 layers. Just crudely saying, the uppermost layer is known as the epidermis. The lower layer is known as the dermis. The epidermis itself has 4 different layers, and the uppermost layer is dead. It's known as stratum corneum. This is very thin, but it is very important for the integrity of the stratum corneum, the outermost layer of the skin, to be watertight. Okay, even though they are dead, it has a lot of ceramides, a lot of cell junctions. It has to be watertight. It doesn't allow any particle from the outside of the body to enter inside. What happens in atopic eczema is there are a few mutations, a few genetic variations due to which the outermost layer of the skin is imperfect. There are microscopic openings. So when that happens, molecules within the environment, in a normal environment, get a chance to enter into the skin. And that immediately stimulates the body's immune system. When that happens, the body mounts an immune response against it, and that is what an eczema is. So how does one go about dealing with eczema? Well, eczema is going to be there for life. Why? Because the way the skin is going to be for a person is determined genetically. We cannot do anything about one's genetics as of now. And since genetics are involved, one can expect the genes to kick in a little later in life when the stratum corneum becomes perfect. So a lot of people do see a remission in atopic eczema later on in life, but that's not the case with most of the people. So what do? We have to make sure that we are making up for the imperfect barrier by using moisturizers regularly. So that will fill up the cracks and keep the outer allergens from entering into the skin. So how often should one moisturize the skin? Well, it's a little tricky depending on what season it is, and also depending on the age of the patient, because atopic eczema begins as early as about 6 months of age, and it can be very stressful for the parents of the children as well. So moisturization has to be done ideally once in 4 to 6 hours. As quickly as the skin begins to dry up, one has to start moisturizing it. In an infant, it becomes a little challenging because using a moisturizer will cover up the cracks in the skin, but it will also end up blocking the sweat glands. So in the summer, when we apply moisturizers this frequently, we can end up causing a heat rash or a sweat rash, miliaria in children. So that's a little tricky. But as one grows up, one should always moisturize the body repeatedly. Apart from that, is there a permanent cure for atopic eczema? No, there is not. We have to just keep moisturizing it. And whenever we have eczema, we use anti-inflammatory creams. And the most commonly used ones are steroid-based creams. So that is something which is not a good thing, because steroids, once absorbed into the body, will have its own set of side effects. So we also have a lot of steroid sparing creams which can be slowly phased in for maintaining the remission from atopic eczema. So one needs to be very patient when managing atopic eczema. Sometimes even the entire family is involved in it. There is a procedure known as wet wrapping, where a moisturizer is applied to the skin, and then 2 layers of tube socks are applied to the skin to the child. So, so a lot of things can be done for atopic eczema, but there is no cure for it.
Okay. Yeah. Thank you, doctor. That was a tough one.
Very tough. Yes.
Yeah. Doctor, we have our next question is from Deepika. She says that I am having acne on my whole scalp.
Okay.
It's burn and pains a lot and also cause headache but no itching. While combing or tie my hair, it pains. Very small bumps are there, and now from few days bumps started coming on my face also, which was earlier not there at all. I'm having this scalp acne from past 2 years. It has increased now. Earlier it was very little.
How old is she?
She hasn't mentioned the age,
Okay.
but I'm expecting around maybe 30.
Okay. So she's been having pimples, pustular lesions on her scalp,
Yeah,
painful
yeah,
for a while, and now she is beginning to see them on her face as well.
correct.
Okay, this is something that we refer to as scalp folliculitis. It tends to be chronic and recurrent, but it can be managed. So why is it happening? We have commensal bacteria within the hair follicles. These bacteria will be present on everybody's skin, but sometimes what happens is there will be a favorable environment for these bacteria to overgrow. That can be because of an alteration in the kind of natural oils that are produced on the skin. It can favor this bacteria to overgrow, and when that happens, the skin reacts to it. We have a pustule. So how do we manage it? Well, the first line of management is with antibiotics. Usually we assess the patient's liver function, because these antibiotics will have to be given for a prolonged duration of time, for about 3 to 6 months in some cases, and that usually causes a clearance. And these can be taken once a year, 3 months at a shot, whenever it comes back. So patients do have a good level of clearance. In case this doesn't work out, we put them on a different drug, which is basically a very purified form of vitamin A. It's basically a retinoid. So what it does is it tries to cause a miniaturization of these follicular glands, so that a favorable environment for the bacteria doesn't exist. Having said that, scalp folliculitis is a challenging condition to treat, in the sense that it cannot be permanently cured. It will always be an on and off phenomenon, but we can provide a very long durations of remission for someone like her. And patients are very happy with that, this kind of management.
Okay.
It has got nothing to do with the hygiene of the patient. So if that's what, because a lot of people with pimples on the scalp might be perceived as having a lack of hygiene. So that is not the case.
Okay. Thank you, doctor. So let's look at.
I hope I'm not getting too technical.
Yeah. Anyhow, yeah, somewhere we have to be technical so that people can understand,
Yeah.
correlate, and get the right
Yes.
information.
Yes.
So that I think that should be fine. Here's a question from a mother. She's saying, my 8-year-old daughter always has sweating in her palms. It wets the and dirties the paper also while she is writing. So she's asking whether this is normal or whether they have to think something or do something about it.
Okay. Okay. So this is something known as Palmoplanter hyperhidrosis. It's an 8-year-old child. So this is as early. For how long has she been having it?
She's 8-year-old, so maybe 2-3 years
Okay.
now.
The duration has not
Yeah.
been mentioned.
Yeah.
Yeah. Okay. So that's how early it begins. So the sweat glands on the palms and soles, they'll be very easily stimulated. Even a little bit of stress will cause it to sweat a lot. And this is exactly the way patients come to me with they can't write their exams. It's literally dripping. It's like this water is just dripping from their hands when they're writing. So is it normal? It's not normal, but is it something to be worried about? Is it in the sense, is it a sign of something else that's going wrong in the body? No, it's not. It's just that they have very hyperactive sweat glands in the palms and soles. So, what can be done about it? Well, there are a few treatments available. So, step by step, we have a lotion that can be applied to the palms and soles. It's an aluminum based salt. So, a lot of people do see results with it. If they're not seeing results with it, the next step is to go for Botox injections. Well, Botox injections are used for anti aging purposes to smoothen out wrinkles. So, the same Botox injections can be injected to the palms and they will decrease the sensitivity of the sweat glands. But Botox injections are not a permanent solution. They will have to be given every 6 months. If it is acceptable to the patient, yes, we go ahead with that. And then there is something known as iontophoresis. So basically, we pass an electric current through the palms and the feet. So this is done on every alternate day. People do see results in about a month or two, and this will have to be continued for life every week. If it's working, this is what I suggest. This can be done at home. If even this is not working, that's when we go in for invasive procedures. So there are two invasive procedures. One is something known as microneedling RF. There we have multiple needles going into the palms. Of course, the palms will be anesthetized. They go in and then an electric current is passed. So that causes a destruction of the sweat glands present deeper within the skin. So about 3 to 4 sessions done 4 weeks apart gives a good level of improvement, which does get sustained for years. Maybe one maintenance session may have to be done every 2-3 years. If even this is not helping, there is a very radical procedure known as endoscopic thoracic sympathectomy. So what happens is the actual nerves which are involved in stimulating these glands are present inside the thorax, inside the chest. So using an endoscope, this can be accessed and these nerves are cut off. So this is a very radical procedure, but this is what is the final treatment for this.
Okay. Thank you, doctor. So that means there are multiple levels of solutions possible.
Yes.
Anyhow, people need not worry because it's normal or it can be treated.
It can be treated and it's not a sign of anything that's going wrong inside.
Okay. Thank you, doctor. So, doctor, I was trying to understand you, and I could see that you have many other interests, like you go for long cycling, long running, and your music also. You are very much interested. You seem to be playing tabla and flute. So, doctor, I know doctors are very very busy, but how are you able to manage the time, doctor?
Okay. Well, so I'm a trained mridangam player. I'm actually trained. The flute I've been learning on my own, and of course I used to rap in Kannada and in English during my college days. I did it professionally for a short period of time, and after that, of course, now how do I manage things? Well, right now all of that has taken a backseat because of my practice, of course. Maybe music just happens over the weekends and fitness happens every day. But then, of course, before I got busy with my practice, I would go on intercity cycling trips. So I would cycle to Mysore or to Chennai or to Mandya, and come back within a day. Chennai, of course, it takes about 16 hours. So there was this one instance where I took 6 hours to get to Mysore. That's just about 25 kilometers per hour. But apparently, it does take that much these days due to the traffic.
Yeah.
4 hours.
Yeah,
So
yeah.
we're just saving 2 hours by not taking a cycle to Mysore. So, but right now, yes, I do believe it's very important to at least stay fit. So I do work out at the gym. Earlier, I have won a couple of long distance races in Bangalore, like half marathons and ultra marathons as well.
That's very nice, doctor. Yeah, let's go to our next question. Mother has asked, my 12-year-old son always has itching near his thigh joints, however clean he keeps. So, doctor, anything, I think without looking at it, it may be difficult. I don't know. So, doctor. would you like to suggest?
How old is the child?
12 years.
12 years. Okay. Okay, fine. So itching between the thighs. So what are we thinking of when we are thinking of itching between the thighs? So when we look at the skin between the thighs, and if there's nothing, if it is just a normal looking skin over there, then it's just the nerve endings there getting stimulated due to the skin rubbing against each other. In that case, we can just give some creams to deal with the itch. That's all there is to it. But in a lot of cases, what happens is there is an accumulation of moisture in these skin folds. And this moisture causes a compromise in the uppermost layer of the skin. It's called maceration. So when that happens, we have a yeast, something known as Candida albicans, normally present there, that overgrows and that causes itching. In that case, one thing is we can use antifungal dusting powders, which can be applied twice a day. And apart from that, what one can do is that at the end of the day, a table fan or a hair dryer at the lowest setting can be used to dry between the thighs for about 5 minutes. So that usually clears it up. So that can be done every day. And this advice would apply to everybody, all men, women.
Okay, whoever is getting itching.
Yes.
Okay.
If this drying is not helping, yes, do get in touch with your dermatologist. That will help you out.
Okay. And cotton clothes or those things can.
Oh yes. With respect to the clothing, cotton clothing is good.
Mhm.
Jeans not so good, and loose fitting clothes should be tried out.
Okay.
Yes.
Yeah. Thank you, doctor.